Stress is a normal physical response to the events that make you feel threatened or upset your balance in some way. When you sense danger, whether it's real or imagined, the body defense kicks in to high gear in a rapid automatic process known as fight or flight or freeze reaction or the stress response. Stress is an uncomfortable emotional experience accompanied by predictable biochemical, physical, and behavioral changes. If left untreated, it can turn into chronic stress, which can cause health conditions such as depression, obesity, as well as insomnia, muscle pain, high blood pressure, anxiety, and weakens the immune system. This form of stress is constant and precise over an extended period of time, according to the American Psychological Association. Stress symptoms, according to the Mayo Clinic, may be mistaken for an illness. Your body may show symptoms such as headaches, muscle tension, chest pains, fatigue, change in sex drive, stomach upset, sleep problems. A person's mood can reflect changes, displaying anxiety, restlessness, lack of motivation, irritability, anger, sadness, or depression. Stress will also affect your behavior, causing symptoms such as overeating, undereating, anger, outbursts, drug, alcohol, and tobacco use, as well as social withdrawal. These symptoms are general symptoms for an individual who is suffering from chronic stress. Adolescents or children, according to Medline Plus, may have a few more adverse symptoms, such as new or recurring bedwetting, nightmares, stuttering, emotional symptoms, such as inability to relax, new or recurring fears, clinging, questioning, crying, inability to control emotion, aggressive behavior, stubborn behavior, or regression behavior back to earlier stages in life, and unwilling to participate in family and school activities. No general test was found to determine chronic stress, but one may notice additional symptoms such as faster heart rate, skipped heartbeats, rapid breathing, sweating, trembling, or dizziness. This concludes that a diagnosis of stress is determined based upon behavior and emotional well being. According to the American Psychological Association, most Americans are suffering from a range of stress. 44% of Americans reported stress over the last 5 years, with no specific percentage of individuals suffering from chronic stress. Over a year, 7.7 million individuals starting at age 18 was diagnosed with PTSD, post-traumatic stress syndrome, which is a form of chronic stress according to the National Institutes of Mental Health. The chosen group of interest is adolescents dealing with chronic stress. According to the National Institute of Mental Health, one-third of children report physical health symptoms associated with stress. There are several causations contributing to chronic stress among adolescents, such as poverty, family, environment, peers, health, finances, and these determinants have sub-causations that we will further elaborate on. According to the researchers in the psychological department at the University of Denver, poverty creates a context for stress, which feeds off one another, adding to the stresses in the future. These stresses can affect children and adolescents adversely by causing conflict among family members, exposure to violence, physical health, and academic achievement. This stress is conclusive with symptoms such as depression, anxiety, hostility, and aggression among poor children. Researchers indicate that stress mediates the association between adolescents' physical correlation and their outcome. The researchers at the University of Denver use a multicultural event to measure poverty-related stress among youth, in which parents report about their own childhood stress as well as their own children, while adolescents provide information about their own stress. Results from this research indicated that 22% of the participants had symptoms of anxiety and depression. 15% of the participants seemed to be withdrawn. 12% had multiple living complaints. 9% were seemed to be delinquent. 7% had aggressive behavior, and 8% had other related stress issues. Another study was conducted by researchers from the Numerous Foundation at the National Association of Health and Education Center. There, 883 adolescents from health centers and education across 6 states had stress issues due to environment, school, and family pressure. A series of questions was asked to indicate causation of stress among these adolescents, and it resulted as follows. 39% said that their homework load was okay. 36% felt like they had too much work to do. Students also indicated a desire for more free time. 45% wanted to hang out with their friends. 26% wanted to participate in physical activity. 13% wanted more family time. And 6% wanted time to just read. Of those who were already involved in activities outside of school, 62% said they, along with their parents, decided on their activities. 39% said they had no say-so on the activities they were involved in. Research suggests that the busier the parents were, the busier the child was. The research from the National Association of Health Center concluded the amount of pressure to be a productive student and athlete is a causation of stress. Also, these case studies, inability to have leisure time to spend with their friends is another contribute to stress. The researchers suggest that the adolescents and their parents may benefit from stress management and coping instruction. Dr. Beth Marsh from the Adolescent Health Center indicates 10 things that causes adolescents to become stressed. Number 1, school pressure and career decisions. Number 2, after school and summer jobs. Number 3, dating and friendships. Number 4, pressure to experiment with drugs, alcohol, and sex. Number 5, pressure to be a particular size. Number 6, pressure to be fashionable. Number 7, dealing with physical and cognitive changes of puberty. Number 8, family and peer conflicts. Number 9, being bullied, exposed to violence and sexual harassment. Number 10, cram schedule, juggling schools, sports, social life, and family obligations. Her research suggests that adolescents become overloaded and begin to display symptoms that was mentioned previously. As indicated in the American Academy of Child and Adolescent Psychiatry, we as social workers have to form collaborations with the parents as well as the teens to provide education and awareness on chronic stress, especially since the signs and symptoms are so similar to physical illnesses. According to the American Academy of Child and Adolescent Psychiatry, the same mechanisms that are used to turn stress responses on can be used to turn them off. As professionals, our job is to educate parents on how to monitor if stress is affecting their teens' health, behavior, thoughts, or feelings, how to listen carefully to their teens and watch for overload, how to learn and model stress management skills, support involvement in sports and other pro-social activities. Social workers, teachers, and parents need to unite and bring these issues to the Board of Education in order to bring awareness and the need for development of stress programs in schools that can teach adolescents to decrease stress with the following behavior and techniques that was indicated in the AACAP. Exercises such as eating regularly, avoiding excess caffeine intake, which can increase the feeling of anxiety, avoiding illegal drugs and alcohol as well as tobacco, learning relaxation exercises, rehearsing and practicing situations which can cause stress, learning practical coping skills, decreasing negative talk, learning to feel good about doing a good enough job rather than demanding perfection, taking a break from stressful situations, building a network of friends who can help cope in a positive way. Chronic stress, according to the helpguide.org, among adolescents can be detrimental to the youth's future, causing memory problems, inability to concentrate, poor judgment, negative outlook, anxiety or racing thoughts, and constant worrying. As a social justice advocate, we must collaborate and bring awareness, education, and solution to this disorder. Bpray Behavior Health is a community-based facility that has an intensive outpatient and inpatient program. Bpray Behavior Health recognizes that emotional, behavioral, and chemical dependency problems can affect all areas of a person's personal life. Their treatment programs are tailored to address each person's unique problems and needs, including chronic stress. Their facility caters to all ages, ranging from 4 years old to geriatrics. They have been very effective in the community as they have recently opened another facility and have received a certificate of excellence. In conclusion, chronic stress can be caused by many different emotional, social, and behavioral circumstances. As social justice advocates, we have to bring awareness to the adolescent community about chronic stress to avoid the long-term scar that chronic stress leaves on individuals. Thank you.